headaches. And we're not talking about the mild every now and then, just take a little ibuprofen and then it's gone forever. Or if you, like I said, have intimated previously, maybe a night of bad decisions. We're talking about chronic headaches. We're talking about headaches that can take you out of action, or you have headaches for 25 or more days a month. We're talking about serious stuff where you have tried everything and cannot come to terms with your pain. Well, there is hope here in the Santa Clarita Valley with the Valencia Headache Center. Here with me, Dr. Dean Schweitzer. Good morning.
Good morning.
We were talking off the air about this and the situation with like ibuprofen as a long-term pain reliever. I was talking about a friend of mine. It wasn't a headache that she had, but chronic knee pain. And eventually she had taken so much ibuprofen that it affected her liver, where she was actually in the hospital for about 2.5 weeks on dialysis. So when we talk about just masking the pain with medication, we're talking about potential serious side effects and health risks rather than treating the root of the problem.
Sure. When you take ibuprofen over and over and over again, it's definitely going to compromise certain parts of your body. Same thing as if you're taking narcotics. Of course, narcotics are addicting, and we all know that a lot of people in debilitating chronic pain wind up becoming addicted to their pain medication. So the goal is to not have to take pain medication to control your pain. People with headache pain usually have tried many, many different alternatives. They've gone to many different healthcare providers, and mostly have been left with just taking a cocktail of medication over a period of time. So what we need to do is we need to get to the source of the problem. And medical and dental research has shown us that most of the time people suffer from chronic headache, migraine headache, jaw pain. It's a result of an imbalance in your bite. You can't feel the imbalance though. You don't know it's there. And you need to have somebody that really understands that and can detect that to determine that.
I'm going to talk about this because migraine and chronic headache sufferers, it's not just pain that they're suffering from, right?
Absolutely not. Pain is just the manifestation that we all talk about. But when you're a debilitating pain and you have pain many, many times a month, it just ruins your life. It takes away from the enjoyment of your life, causes depression, anxiety, you miss work, and it can be life-altering.
I've had known people in various sectors where it's like all of a sudden something has been canceled because they have to be in a dark room laying there and not even able to handle it. I've seen people that are in so much pain they're practically, or if not, crying or at least moaning from that level of pain. So we're talking about having the ability to relieve that level of pain without medication, with treatment that is a course of time, but not a long period of time. I mentioned in another interview talking about orthodontics, which takes a couple of years. We're talking about it over the course treatment that up to 12 weeks. That's it, right?
Yeah, that's correct. Over 113 million work days a year in this country are lost because people are staying home because of a headache. So it's a pretty pervasive problem. And the solution doesn't involve anything invasive. It doesn't involve dental work. It doesn't involve orthodontic treatment. It doesn't involve surgery. It involves precisely determining where the imbalances are and adjusting those imbalances in a very easy, very quick, very imperceptible way over a period of about 12 weeks. We do it about once a week, and we combine that with rehabilitative therapy to get the muscles healthy. And then at the end of that time, and even before that time, patients' headaches just basically disappear.
And it's not necessarily that you got to wait till the end of 12 weeks. In a lot of cases, you're saying that some patients start to feel relief sooner than that.
And almost immediately after the first one or two therapies with us, they start to begin to realize, wow, this is really going to work for me. We have a 93% success rate nationally of the tens of thousands of people that have been treated with this protocol for the last 10 years. In our practice, that percentage of success is even higher.
Well, that's amazing. And of course, the Valencia Headache Center located right here in Santa Clarita. And we're talking about imbalances in your bite that cause headaches. And a lot of people don't realize that. And the headache is up here. How could it be in my jaw or in my mouth? I don't understand that. But that is why you are the professional. And I think it's not a radical sense, but it makes a lot of sense or the approach, I should say. It's not a radical approach. It actually makes a lot of sense when you think about it. And you mentioned earlier the pebble in the shoe scenario.
Yeah, the pebble in the shoe is my favorite scenario to help people understand why an imbalance in your bite can cause headache pain. When things are out of balance, what happens to our bodies, it's the muscles that are uncomfortable. And in our face, we have muscles, and our muscles control our bite. So if our bite is out of balance, even though you can't feel it, it's very imperceptible, The muscles are constantly straining and constricted, and it results in headache pain.
Now, what's interesting, Dr. Schweitzer, is that you are a dentist.
I am a dentist, absolutely, because only a dentist can understand and provide this treatment.
That's amazing. And how can headache sufferers find out more about what you have to offer?
Well, they can call us at 661-287-9667, or of course they can visit our website at valenciaheadachecare.com, and we invite people to come in for a complimentary consult just to get a better look and see what's going on.
And if you are one of the 45 million headache sufferers across the nation who, especially if you are being affected 25 times a month.
Sometimes up to 25 times a month.
Or even less, where it's just stopping you from doing what you want, or fulfilling your day/life. If you are taking medication, especially if you're not receiving any relief, or even just want to find out a better way so you don't have to be relying on that medication, Valencia Headache Center is the place to go. ValenciaHeadacheCare.com is the website, and get more information and make your appointment. Complimentary consultation, or you can go for the whole diagnostic right then and there.
Absolutely.
Outstanding.
Thank you.